Hi, welcome back to my channel. In this video, I will be talking about Index of Orthodontic Treatment Needs IOTN in a very easy way, and I'll also give a very easy format in which you can basically remember most of the components, and like this is as basic as it can get. So first of all, IOTN. So it was you should know the people who gave it. So it was given by Brook and Shaw in 1989. All right. So Brook and Shaw in 1989. Now it has two components. So one is the dental health component and one is the aesthetic component. Alright, so aesthetic. So this is DHC and this is AC. Now there's a MOCKO criteria that we follow in IOTN. Alright, so you should know about the MOCKO criteria. Now these are the factors that are like evaluated. So M is missing teeth, O is overjet, C is cross bite, D is displacement of contact points, O is overbite. Now here few things to know. In this you will see that missing teeth will also include developmental abnormalities like cleft lip, cleft palate, plus it will involve the ectopic teeth, plus the impacted teeth, plus the submerged teeth. Okay, in overjet we will talk about overjet plus reverse overjet, crossbite, then displacement of contact points. Now this is the displacement from ICP to RCP. Okay, then like this is intercuspal position, this is retrocuspal position, overbite. All right, yeah. So this is about the MOCKO criteria. Okay, now let's just go through the component. So first I'll tell you about how to remember the dental health component, and then we'll talk about the aesthetic component, and then we'll talk about the final scoring. So see, in this what you need to do is you just have to make a line and so 5 4 3 2 1, and here we will write about the IOTN dental health component. So see, first we'll talk about MOCKO. So missing teeth. Now you have to take the number and you have to write A because we're talking about the first thing that's happening. So over here nothing really happens in MOCKO, but here in 4A you will see less extensive hypodontia. Then in 5A you will see extensive hypodontia. So basically in this I just forgot to tell you, so we are talking about hypodontia, so we will mention H. In this now first component you have to remember his. So 5I impacted teeth, then 5S submerged primary teeth. Okay, so this is about missing. Okay, now second MOCKO. So see, overjet. Now overjet, so start from here 2A 3A 4A 5A. Okay, overjet ki you just have to know the value. So 3.626 mm with competent lips. In one you have nothing, okay, like normal. So 3A you have again same 3.626 mm, but you have incompetent lips. Then this is 6 to 9 mm and 5A is more than 9 mm overjet. Now in this we have second component also. I told you in overjet we also include reverse overjet. So we'll talk about reverse overjet. So second component, so B. Okay, In this again just know the value, so reverse overjet. So 1 mm, 3B may you have 3.5 mm. In this you have more than 3.5 mm. Plus or minus you can have masticatory problem, basically no masticatory problem or speech difficulty. In this 5A again you have more than 3.5 mm, plus you will have masticatory and speech difficulty. Okay, now done with this component. So this is 5B. Okay, reverse overjet. Yeah, then now let's talk about MOCKO again. So C component. So C was crossbite, if you remember. So we give something nice color. So you have to talk about crossbite. So C, right? So 1 as usual nothing, 2C, 3C, 4C, and here you have 4L also. Now 2C, what is 2C? 2C is 1 mm, okay, crossbite, and then 2 mm, then more than 2 mm, and L is posterior lingual crossbite. Now done with this also. Now let's talk about another next one. So MOCKO D, displacement, right? So yeah, 4. So displacement of contact points. Now in this you have first minute thing, then D, 3D, 4D, then 4T, and then 4X DTX. So 2D is 1.1 to 2 mm, 3D is 4 mm displacement, 4D is more than 4 mm, T is partially tipped teeth, and X is supplemental teeth. Okay, then last, I hope you are with me and it's not difficult anymore. So let's take nice color. So MOCKO. So 5th was over bite. First may as usual nothing, 2E, 3E, 4E, and 4F. 2E again same, 1.1 to 2 mm, same as the upper one, 4 mm. Then this is more than 4 mm, and 4F is more than 4 mm plus complete overbite plus gingival or palatal trauma. So this completes the IOTN dental health component. Okay, so see, it's easy if you like just go through it with me. Then once there was a question, they asked cleft lip and cleft palate is which score, so it is 5th. Okay, and borderline also they asked, so that's 3. Now aesthetic component, I'll just talk about it here. So aesthetic component, it has 10 grades. Now this is something which is given by the IOTN itself only, like by the proposers. You have to compare it with the photographs that they have issued. All right, so you just have to like by heart the photograph. Now we'll just go through photograph also, like this will only come in the exam, no other photograph is going to come, so you should know. See, let's just go through them one by one. See, so grade 1, everything is like perfect. Now grade 2 is here. So you can see this overbite, deep bite, right? Then 3 may we can see, I think posterior something. Then this 4, then 5 is like very adverse overbite, deep bite. Then the see this one, so this, then this is bad, and then this is, see properly these components, right? Then this is like so bad, and this is tipped also. So like you have to make yourself only the thing that what you're going to see, like this will be repeated, like the whole image is just same. Like now I'll tell you, once they put this photograph in an Ames question and they asked me what grade is this. So like see, if you remember ki tede mede are there, so that's 10. If you see pure hi niche, like mandibular anteriors are not visible, 9. If you see thoda bahut are visible and this, so 8. If you see फिर से mandibular anterior है नहीं, right, but you can see these, right, and somewhat here, so this is 7. Then this occlusion missing, 6. Then see this, all right, 5. Then thoda bahut 4. This also, and this is ठीक है, this increased. So like this you'll have to make your key yourself, like this particular photograph will only be asked. Then this is about IOTN. Then there's one more thing left. See, scores. So like if they ask you like most attractive score is most attractive, so obviously it's going to be 1. 1 has no problems, either DHC or AC. Then the ugliest or the least attractive is 10, right? Then treatment protocol, so 1 to 3 require no treatment, 5 to 7 borderline, and 8 to 10 treatment required. So this is about IOTN, and I hope I made it easier for you to understand.